So we're here at the 2024 Cell Coast Conference, the first ever conference sponsored by Moffitt, where we're looking about how cells can be used to treat cancers. And I'm here with a worldwide expert in the treatment of myeloid malignancies, Dr. David Sallman. Thank you for speaking with me today. Tell us a little bit about what myeloid malignancies are and sort of how they can be treated with cellular therapies.
Yeah, so they're very aggressive malignancies that essentially invade the bone marrow biopsy and essentially prevent our body from making normal blood cells. So they're at extremely high rates of infection, bleeding, issues from very high transfusion burden, and they're aggressive things. Patients can go from 5% blast to 100%, really overnight. It's a logarithmic, growth. And although we have more and more effective therapies, once patients relapse or fail chemotherapy or venetoclax-based therapies, they unfortunately really have no treatment options. You're talking about a survival in weeks to months in that setting. Really need novel therapy such as CAR T.
And so, for patients who want to receive cell therapies, are there any that are FDA approved, or is it mostly out of clinical trials? And if they are clinical trials, what's the most sort of exciting clinical trials that you see right now?
Yeah, so there are unfortunately definitely no approved therapies to date. I think we've been trying for now over a decade of CAR T, and there's lots of different hurdles as far as target, burden, T cell dysfunction, et cetera. But to your point, clinical trials, are the key, and we're actively enrolling really at all times onto trials. As far as what's most exciting, I'm probably in general a little bit more excited for allo CAR T based products. Particularly around the T cell dysfunction in our patients and really being able to treat the patient at the right time, given again the rapid kinetics of the trial. So we have two open allo CAR Ts, one targeting CD123 and a relatively new one targeting CLL1. And so we're excited because we have patients who have failed all options and have had beautiful remissions, but it's just not been reproducible or predictive, and we're working on that. I think maybe one of the key considerations is we're now going to start targeting patients with very low levels of disease, what we'd call MRD positive, and maybe that will circumvent a lot of the challenges that we've had to date.
Great. Well, thank you very much for sharing your expertise, and we're really looking forward to development of cell therapies in the myeloid diseases, really giving great results in those diseases in the future. So
Thanks for having me.